Hello, I'm Dr. Rebecca Sunenshine, Medical Director for Disease Control with Maricopa County Public Health. As you may have heard by now, a child in our community tragically passed away from a serious respiratory disease. On behalf of public health and as a mother myself, I want to extend our deepest condolences to the family and the community. There's been a lot of speculation on whether this child's illness was caused by Enterovirus D68, which is one of many viruses that can cause colds or flu, but can also cause severe disease. Testing for multiple viruses, including Enterovirus D68, is underway, and it could take up to 10 to 12 days for us to get the results back. We understand the anxiety and stress this news may cause our community, especially our teachers, parents, and caregivers of young children, and I want to take a few minutes to pass on some important information. In most cases, enteroviruses cause symptoms such as the cold or flu in both children and adults. These symptoms can include fever, runny nose, sneezing, cough, body and muscle aches. Children, especially very young ones, can get much sicker than adults with these viruses because they haven't been exposed to as many viruses and they haven't been able to build up the immunity that adults have. What we know about this particular strain of enterovirus is that in some cases, symptoms may rapidly become very severe. Parents, it's difficult to know when to take your children in to see the doctor. I struggle with this myself as a trained medical provider, but this is what you need to watch for. If your child starts to experience wheezing or any difficulty breathing, lips turning blue, take them immediately to a healthcare provider. Children with asthma are at much higher risk of serious complications from respiratory illness, so if their wheezing gets worse or you need to use inhalers a lot more often, make sure you take them in to get evaluated, and make sure they stay on their inhalers and other asthma medications. Even though we don't yet know what specifically caused this child's illness, it's important to understand that all respiratory viruses, including Enterovirus D68, are spread in the same way as the common cold and flu. This is through droplets made when people cough, sneeze, or talk. These viruses can be prevented the same way as the common cold and flu. Parents, please take this opportunity to teach your kids to wash their hands often with soap and water or with alcohol-based hand gel. Tell them to avoid touching their eyes, nose, and mouth. Teach your children to cover their cough and their sneeze with the inside of their elbow. And please keep your kids home when they're sick, especially if they have a fever. Lastly, there is a vaccine available to protect your child against the flu. Even though we don't have vaccines for these other respiratory illnesses, if you get your child vaccinated against the flu, that's one less thing that we have to worry about as parents. While it's important for the family, school, and public health to understand what caused this child's illness, the strategies that I described are not going to change whether or not this child comes back positive for Enterovirus D68. In public health, we will continue to actively monitor for infectious disease reports in the community and work with schools, childcare, healthcare providers, hospitals, and the community to make sure we keep them informed. For more information on Enterovirus D68 and locations for where you can get your flu shot, please visit stopthespreadaz.org.